A chilling first, a U.S. resident has tragically become the first known person to die from the rare H5N5 strain of bird flu, sparking concerns but also reassurance from health officials. But how worried should we really be? State health officials in Washington are emphasizing that the overall risk to the public remains low, but this unprecedented case demands a closer look. The individual, an older adult residing in Washington state and already facing underlying health challenges, was receiving medical care for the H5N5 avian influenza strain. According to the Washington State Department of Health, this appears to be the first documented instance of human infection with this particular strain. The patient's illness had progressed since early November, with symptoms including a high fever, confusion, and respiratory distress, ultimately leading to their death. Investigations revealed that the individual, who lived in Grays Harbor County, approximately 78 miles southwest of Seattle, kept a backyard flock of domestic poultry. These birds had been exposed to wild birds, which are known carriers of avian influenza viruses. This exposure is believed to be the source of the infection. While the news is undoubtedly concerning, state health officials are keen to emphasize that the risk to the public remains low. They have stated that no other individuals connected to the case have tested positive for the virus. Furthermore, they are actively monitoring close contacts of the deceased, but stress that there is no evidence of transmission of this virus between people. And this is the part most people miss. While human-to-human transmission hasn't been observed in this case, it doesn't mean it's impossible in the future. Earlier in the month, the Centers for Disease Control and Prevention, CDC, released a statement regarding the infection, affirming that available information does not suggest the risk to public health has increased as a result of this case. But here's where it gets controversial. Some experts argue that any new strain emergence, regardless of immediate risk, should be treated with utmost caution, particularly given the potential for viral mutations. It's important to understand how H5N5 relates to other bird flu strains. Health experts believe that H5N5 doesn't pose a significantly greater threat to human health than the more familiar H5N1 virus. The H5N1 virus was behind a wave of approximately 70 reported human infections in the U.S. during 2024 and 2025. The majority of these cases presented as mild illnesses, primarily affecting workers on dairy and poultry farms. For example, farm workers who had close contact with infected cows had mild symptoms, like conjunctivitis. The key difference between H5N5 and H5N1 lies in a specific protein that plays a critical role in the virus's life cycle. This protein is involved in releasing the virus from infected cells, facilitating its spread to neighboring cells. The subtle variations in this protein might affect the virus's transmissibility or virulence. So, what does this all mean for you? The official stance is that the risk remains low. However, this unprecedented death serves as a stark reminder of the ever-present threat of emerging infectious diseases. Could this isolated case be a harbinger of things to come, or is it simply an anomaly? What precautions, if any, should the general public be taking? And, perhaps most importantly, how can we improve surveillance and prevention efforts to mitigate the risk of future outbreaks? Share your thoughts and concerns in the comments below. Do you think the authorities are adequately addressing the threat, or should we be taking more aggressive measures? Let's discuss.